There were times when delivering a healthy baby was considered a rebirth for a lady. But for the modern woman, it's a great deal of change in her lifestyle. Apart from changing priorities and schedules, she has to go through a big change in her body and mind. For all those mums who love themselves and who would like to enjoy their motherhood without changing their inner self, hi, I am Dr. Deepthi, a plastic surgeon who's here to give you some practical ways of how to be you. We all know that pregnancy is a surge of hormones. Progesterone, estrogen, oxytocin. All through your pregnancy, these hormones peak at different levels of pregnancy and then drop around 1 to 2 months after your pregnancy. One of the most important hormones in pregnancy is progesterone. Progesterone is that hormone that works on increasing the elasticity and consequently the flexibility of the ligaments on your body. So this elasticity will help the mother to push the baby out into this world easily. This progesterone cannot differentiate between a pelvic floor ligament and the other ligaments in the body. So as a consequence, all the ligaments in your body show increased elasticity and flexibility. And this increased elasticity decreases as you age in pregnancy, and also the recoil capacity of the ligaments decreases when you become pregnant at a later age. This progesterone droops after around 2 to 3 months after your delivery. So if you have heard our elders telling take care or going to rest for around 40 to 60 days after your delivery, how important is it? I see that modern women don't really want to take rest or take a break immediately for so many days continuously after pregnancy. They are more keen on getting back to work after 1 month or 2 months. But how safe is this? When your progesterone is still high in the body, as I told previously, there is an increased elasticity. During this phase, if at all, if you have to do a activity which is not your usual routine, this would strain the ligaments more than your normal phase. And once the ligament is strained in this phase, it would not recoil back or repair itself as it was when it was normal. So you will have those pains or the disability that's caused with the strain permanently in case you don't take care at this time. The good part is that progesterone droops after around 40 to 60 days after your delivery, and all the ligaments recoil back to their primary state. Whenever you try to get pregnant at a later age or late pregnancies, the recoil capacity of your ligaments comes down. So, all the ligaments which have been hyper stretchable during pregnancy fail to recoil back. This is why you see a drooping body frame after your pregnancy, if at all you have a later pregnancy. The primary thing is try to have more body massages during pregnancy so that there is an increased circulation and your ligaments are always in a high recoil capacity. Don't meddle with the tummy area. All the other body parts can have a very mild massage just to increase your circulation. A regular walk also can help you in enhancing your circulation. Coming to the most important part of a female framework, breast. There's a generalized increase in the size of the breast. Added to that, there's an increased elasticity of your ligaments which support the breast. And then added to that, there is a kind of burning of the breast fat during your lactation period. So just imagine, you have a heavy bag and the contents of the bag are getting slowly depleted as you go through the lactation. And also this elastic bag has failed to recoil. What happens? We are left with a drooping, sagging, unwanted looking breast. So how do we deal and how do we not go into this stage? Right from the day that you knew you had a positive pregnancy test, your breast size increases. So please invest in a very high quality lingerie. This lingerie should not just support the under area of the breast, but it should have a good elastic capacity where it can hold the entire breast in its position. The ligaments holding the breast should not have a need to hold the breast. That work should be done by your bra. And this good lingerie should work on your body till at least 1 year after lactation. That is when your breast comes back to your normal position. And also, as on your body, please do regular massages on your breast. This will increase the blood circulation to the ligaments that hold the breast, and then they retain their good recoil capacity, and then this pulls back the breast to its original position. The sad part is your breast will never get back to its original position, but these steps at least help in avoiding a bad looking breast. Your tummy expands all through the pregnancy. There's almost around 10 inches of a change in your tummy circumference. So, the biggest concern that we have, apart from a sagging tummy, is how to avoid stretch mark. Skin is a very elastic organ. So, it expands all through your pregnancy, allowing the baby to grow to its fullest size. But there is a point at the end of your pregnancy where this elasticity is over empowered and the skin tissue starts to break. So the point where there is a break in the elastic component of the skin is where you see the stretch mark. So plan on increasing the elasticity of the skin right from the moment you know you are going to have a baby. You can also plan much before you plan your pregnancy. At least 1 year before your pregnancy plan, increase the moisturization level to the area that is going to have these stretch marks. Invest on good high quality moisturizers or any body oils. A regular massage on this area with a body oil or a moisturizer just keeps increasing the blood circulation and consequently a good high quality elastic tissue. When you continuously do this all through your pregnancy, and this is not just for the last few days of pregnancy, and during your pregnancy phase also, please increase the time of moisturizer application. This should be roughly around 4 to 5 times a day. Don't wait till the skin starts to stretch and have a stretch mark. Plan on improving the core strength much before you fall pregnant. Always, whether you are planning for pregnancy or not, core exercises are very important as a lifestyle change, and this will improve your center of gravity and the positioning of you so that you don't develop other associated problems in terms of spine or your legs or standing positions and your neck pains and all. For the first pregnancy, your recoil capacity of the rectus is still good, so you might have a better recoil after your first delivery, but I have seen this pattern in many women that they plan to work on their core strength after completing all their pregnancies. No, it doesn't work that way. After your pregnancy, there is already a decrease in your core muscle strength, and if you avoid working on it in between both the pregnancies, after your second or third deliveries, the core recoil capacity completely deteriorates and it would be very difficult for you to regain your original core strength after all your pregnancies. So before and in between each pregnancy and after your final pregnancy, concentrate on improving the muscular capacity of your core muscles. In case you don't have a good core muscle strength, the whole body framework while you stand up changes. Your center of gravity changes. It moves forward along with your muscles. So there is an increased curvature of your spine and you develop long-term back aches. We all love how our hair grows in pregnancy. The estrogen surge in our body helps the hair to grow enormously in terms of volume and also the rate of growth. Every female must have experienced this huge increase in the hair growth. But what depresses us is that you start losing a lot of hair at least 2 to 3 months after your pregnancy. So do you have to really worry about it? The estrogen surge that has caused the increase in your hair starts dropping around 1 to 2 months after pregnancy. So you're just losing that extra amount of hair that you have grown through your pregnancy. This is nowhere a fall, a regular hair fall, and this is not going to do anything to your hair volume as such. We see a great deal of increase in the elasticity of our pelvic floor and pelvic muscles. There's a great weight bearing onto these structures. The pelvic floor and the pelvic muscle sustain this weight for around 9 months and take a great effort when they have to push the baby outside. They get tired. If in case you take care during pregnancy and train them to take care of the baby and the delivery, they show a good support after the delivery. They try to recoil back very well. How do we take care of pelvic muscles and pelvic floor? That's much internal, and our regular exercises will not help. Kegels. Kegel exercises we all have known about recently helps a lot in improving the tone of the pelvic muscles. Regularly, right from 1 year before planning your pregnancy, work on Kegels. Kegels is a very normal exercise which you can do at your office or while even watching TV. It wouldn't really change your daily schedule. At least do Kegels for 10 minutes 2 times a day for a period of 1 year before your pregnancy and all through your pregnancy. The Kegels exercise increases the blood circulation in your pelvic floor, and again it increases the recoil capacity and maintains the tone. So you won't have to worry about your sexual life or functional life after your pregnancy, and there are no complaints of urinary dribbling or a lax vagina after your pregnancy. Pregnancy takes a toll on the mind too. Progesterone is a hormone which actually helps us in increasing the elasticity of all the ligaments, as I told you before. But you'll be surprised to know that progesterone actually works on increasing the demyelination of the nerves. This actually is a mechanism to reduce the pain sensitivity of the mother for childbirth. It actually works on the same thing. It can't differentiate between a nerve which helps in pregnancy and the other nerves. So there is an increase in the demyelination of the nerves in your brain. You must have all heard this term pregnancy mind, and it is absolutely true and organic. You tend to forget a lot of things. You tend to actually let go of many things. There is no focus on your work, and this is very common for everybody. Don't worry that you'll not get back to your original focus or your original capability of your thought process after pregnancy. You can still work on it. Always try to engage yourself in happy activities all through your pregnancy. Endorphins again help in remyelination, and also try on learning some new activity very regularly all through your pregnancy and lactation. This will keep your mind busy and decrease the levels of depression that you have to deal with during and after pregnancy. And to keep your mind in a healthy and a happy state, it's very important to have a very strong support system, whether it's your husband or your in-laws or your family. Try to have a good rapport with all of them during these phases so that they're given the needed support whenever you want. If I have to conclude on what all you can do to save your body and mind after pregnancy, first of all, plan your pregnancy at the right age. Try to finish all your pregnancies before 30. I know there are a lot of career obligations, but still, pregnancy is something which you can't avoid or plan in later age unless it's for important reasons. This early planning will help your body to recoil back to its normal state all by itself, and you don't have to really work on your body if it was planned in the right age. Take the right amount of rest needed during the pregnancy and in your postpartum period so that the hormones that the body is trying to expel happens properly and all the tissues come back to their native state all by themselves. And always invest on the right lingerie to maintain your breast support. Plan your Kegels properly at least 1 to 2 years before pregnancy, and load yourself with good amount of moisturization wherever you feel there's an expansion of your skin, whether it's your tummy or your breast.